Hello, this is another Back to Earth interview with me, Caitlin, the founder of Kava Yoga, and today we have a very special guest. I saw recently on social media that a friend of mine who is a nurse here in Central Florida has decided to head to New York City to help with the crisis in the medical field and show her support. So I was really inspired by that, and it really gave me a feeling of hope that even within kind of my circle here, there are people that are stepping up. So I asked her to talk with us, and so here she is, and her name is Britt, and welcome, Britt.
Hi.
Thanks for making time to talk to me today.
Yeah.
So can we start by just tell everybody a little bit about what it is that you do and a little short bio to leading up to your current situation?
Okay. So right now I'm a cardiac intervention nurse. Technically it's critical care. And so I became a critical care nurse when, basically I was a CNA for a very long time. I worked in neurology and I did that while I was in nursing school. And then once I finished my BSN, I decided that I was going to do cardiac. Cardiac was actually the thing that I was the worst at in school, so I wanted to get better. So that's why I chose cardiac.
Wow.
Yeah. So it's great because cardiac intervention is considered a PCU level unit, which is like a step below ICU. And so I basically, after that, I got my year of experience. My plan was always to do travel nursing.
Okay.
And then when all of this started happening, I just decided that, now was the time. Especially New York has such a critical shortage of nurses right now. I'm actually on a group. Sorry, I'm kind of going off topic right now.
We'll swim around to the different bullet points.
Okay. But yeah, so I'm actually on a group on Facebook with a bunch of travel nurses, and they just talk about their jobs around the US. And so there's been a lot of nurses recently posting that were in New York, and they're just talking about the conditions there.
Okay.
And so I think that's what really inspired me to go and help, because it's bad up there.
Yeah, so they're kind of just venting to the group, so it's to someone who can understand, so to other nurses, and just saying like, hey, like this is what's going on. And then are you part of like a crew that's heading up there, or have you decided to go as an individual?
So I am actually going as an individual. I decided to sign up with Cross Country Nurses. They are a travel agency, and they are the ones who got me the position that I'm going to.
Okay. Wow. So you decided to do cardiac because it was the hardest thing, and then you're going to do travel nursing, which is basically like going to places that have the biggest challenges. Or I mean, are you, as a travel nurse, does that mean that you're following where, you're going into where there are problem areas, or is it like you have a season or something like that you kind of bounce around?
So you sign contracts, and they can vary in length. Sometimes they're 4 weeks, sometimes they're 13 weeks. I know New York right now has some where you work 21 days in a row, and then you're off for 2 and you work another 21.
Wow.
That's a little intense. I didn't want to do that.
Yeah.
But I did sign a contract with Staten Island University Hospital, and I will be doing that for 13 weeks.
13 weeks.
So,
Cool.
yeah.
So, what's it going to be like when you get up there? Are you like going to hit the ground running? Do you have a place to stay with people that you know, or like what's the arrival going to be like for you?
So I actually worked it out with a hotel on Staten Island, where I'm going to be staying there for the duration of the contract. And they just, they're so desperate for nurses there. There's a lot of hotels that are willing to work out deals with nurses.
Wow.
Yeah, so I will be doing that. And then as far as me knowing anyone there, I mean, I have a couple of friends that live in Brooklyn, but of course, they don't work in healthcare, and
Right.
personally, I wouldn't want to expose them to anything anyway.
Sure.
So maybe by the end of my contract, I'm hoping that this kind of blows over, but it's not really looking like it's going to.
Yeah.
Um, so
So what are you doing? You leave on the 10th,
on
right?
the 10th, yes.
Today's the 6th, so you're leaving in 4 days. What are you doing to prepare yourself?
Mentally.
Always, I guess.
um, Well, I have definitely done a lot of like meditation
Yeah.
and journaling. Um, I mean, it's definitely a very stressful time. I think it was a lot to go into it because I packed up all of my belongings and I put them in storage. Um, and also I don't plan on coming back to Orlando afterward. So that's kind of another challenge, like just having to make sure everything is in order before I leave.
Yeah.
Um, yeah. So definitely lots of meditation.
Yeah. I didn't know that you were going indefinitely, so are you just playing it by ear as far as what happens after the 13 weeks?
Yeah.
And so if you're needed somewhere else, or maybe you like reapply there or something, you're just leaving it up to the universe for now.
Yeah. I'm just leaving it up to the universe. I do know that, by the time my contract ends, Florida their numbers have been rising substantially in a very short period of time.
Mm-hmm.
I know that they in March, or not March, May, they're expecting the peak. So, New York is kind of just now hitting their peak. They're thinking that they might be around, or that it might be maybe like another week or two before they actually hit their peak.
Wow.
Yeah. So if that's the case, I mean, there might be a need for me here in Florida again. Maybe not necessarily Orlando, but, we'll see.
Yeah.
Whatever the universe decides for me.
Wow. You're the nurse of the universe. So, I mean, how did you said that you were on a Facebook group when when you made this decision, it was because you were seeing these firsthand accounts of people that are in New York already. But is there like a definable moment that you remember that you were like, I'm going to do this? Like, is there something you read or?
Um, Actually, yeah, there were a few nurses that had posted and they referred to it as like wartime nursing.
Yeah.
Um, they were saying that, some of them have 10 patients to one nurse, and that's a lot. I mean, especially most of these patients are on vents. They're very ill. And so they're kind of, you have these med surge nurses, which is a lower level of care than, what I do.
Mm-hmm.
And they don't have the training for vents. They don't have the training for some of these drips.
Wow.
And they're kind of giving them a crash course in what it is that, they have to do. And then they're hitting the ground doing it with, so many patients.
Wow.
But I mean, they don't really have a choice, right? They don't have the staff. The hospitals are so overwhelmed that they just have to do it.
Yeah.
And so I figured, I do have experience, and I mean, hopefully I won't have a 10-to-1 ratio,
Yeah.
because that is a lot. And
What's a normal ratio?
so for my unit specifically, we get anywhere from 3 to 5 patients.
Okay. Wow. So it's
Um,
a lot for sure.
Yes. And you're thinking that's like a critical care environment, right? You might have, I mean, if you go to a higher level of care like ICU, you're going to have 1 to 2 per nurse. PCU is always kind of 3 to 5. And then med surge, you'll have like 6 to 7. So just having those additional patients that are on ventilators, on drips, that is very difficult. Um, and yeah, I mean, I feel like at that point, you're basically just checking on them to make sure that their drips haven't run out and that they're still breathing.
Yeah. Yeah, it definitely, when I was thinking about talking to you, I was like, I kind of feel like I was getting ready to talk to someone who's going to war. Like that is how it seems, because when you talk about the conditions and the schedule and, um, you know, it's a lot. I was wondering, like, do nurses and doctors get scared, like get fearful or scared because it seems like everybody just steps up. It's almost like it's in your nature when you're called to be in the medical field that you just have this like chromosome of courage that allows you to, you know, handle these situations. Do you see people, you know, fellow nurses and doctors, is everyone just like super strong mentally, or have you seen anybody kind of start to be a little bit worried?
Um, I think that you mean like worried about the current situation. I think that,
Yes, but like I just never I just don't really ever see nurses get like shaken, you know, or they really, you guys just have like great composure. But
yeah, I think a lot of us are probably very strong. We become, when we see the same thing over and over again, we become so desensitized. If a patient codes, for instance, we know the algorithms, we know what it is that we're doing. And so it's just a matter of following what we've been trained to do.
mhm,
So in that aspect, I think that we, it's not always necessarily about bravery. It's just we're doing what we know, what we have to do.
yeah.
Um, but there are times I think that you see certain nurses that do have more experience, or maybe they are stronger. They do tend to step up a little bit more. So yeah.
Cool. What does your family think about all this?
They are terrified for me.
Yeah.
Yeah. So,
Probably
and
super proud too.
maybe on some level. I do know that my mom, like, she would love to see me, but of course she's scared. I've already had contact with some of these COVID patients.
Oh, really?
Yes. So she doesn't want to see me. Well, I'm sure she does, but she can't. Maybe I'll do a drive-by and wave at her.
Yeah. Oh, yeah, I'm sure she wants to give you a hug, right, before you leave, but
Of course, yeah.
I didn't know that you had already been exposed. Was that on purpose that you were assigned somebody, or did you find out afterwards, or how did that happen?
No. So we've been getting patients that are positive. Um, and so we are putting them in negative airflow rooms, which is, for anything that's airborne. These patients are, some of them are getting breathing treatments, and that aerosolizes the virus. And, when it does that, it makes it so small that it's in the air. And since it's suspended in the air, we have to wear special masks. And so my unit in particular has one room that is negative airflow. So we are getting those patients.
Wow. So, a lot of people think that the media is, you know, changing the information that we're supposed to receive and everything. Can you confirm, as a medical professional, that this is indeed an airborne virus or contagious by, you know, in that method, and that it's asymptomatic?
Well, I am, that's kind of out of my scope of practice, right? But I will say that The CDC is saying that it is droplet unless we're doing a procedure that aerosolizes the virus. If they are on a vent, that's going to aerosolize the virus. If they're getting a breathing treatment, it's going to aerosolize it. If they are on
what is aerosolize? Sorry, I'm not familiar with that term.
it makes it go up, like it suspends it in the air.
Okay.
Right? Yeah. So yeah, and then if they're on a CPAP, BiPAP, it's going to do the same thing. I think at this point, a lot of doctors are really going from, because it's kind of inevitable when you start to decline. You know, they're starting them off on a nasal cannula that's high flow. We're putting them on like 5-6 liters, sometimes higher than that. And if we start seeing that they're rapidly declining, they kind of skip over the CPAP at this point, and they're just intubating.
Mm-hmm.
So because it's kind of inevitable.
Yeah.
So yeah.
Gnarly. So for me, I really look forward to talking to you because for Central Florida and for a lot of our same friends and stuff, like you represent a very special effort right now from our generation and from the medical field. And so I think that that's going to be really inspiring and also hopeful that people see that there are people like you in the world that are, you are brave and we're very proud of you. And you're a social person and you're an active person and you're a professional. So is there anything that you can say from that platform as, a Orlando native, social, active, professional nurse, young woman? What can you share with us?
As far as like what advice I can give during this time?
Yeah.
I definitely think it's going to be really important which I mean, they're saying this on the media, but definitely social distancing. And I think, social distancing is a very broad term.
Mm-hmm.
It doesn't give any specifics, and everyone makes their own definition of what social distancing is, right? So you see people that are still hanging out with their friends and still, they might just be going to their house, but they're still hanging out with them. And so I think, just to be more specific, social distancing really means that you're sitting at home. You're staying with the people that live with you, because you don't want to potentially expose yourself or expose other people. Even if you're hanging out with the exact same people every time, you don't know what those people are doing when you're not around. If they go to the grocery store, they could be coming into contact with someone else that is sick or that does have, symptoms that aren't showing. Or they could just be a carrier and be asymptomatic. And then you're bringing that home to yourself. You're bringing that home to your family. And, everyone is reacting to this virus differently. Yes, you do have people that are older that have comorbidities that are getting very sick, but you also have people that are younger. There are doctors in New York right now that are on ventilators that are 30 years old without any comorbidities. Wow. So it is serious. And I think people need to start really taking things more serious and making sure that if you are going to the grocery store, you're not going several times a week. You want to try to limit that as much as possible. And I know it's difficult, especially, who wants to stay at home all day, right? Like, people are social, people want to go out, but definitely, like, you have to take it seriously.
Yeah, it's hard, but people need to deal with it, for sure. I think as mindful as we can hope to be, we just don't have the mental capacity, I think, to be so hyper aware that we would need to be, that we're not accidentally touching something, accidentally coughing on something, you know, even in our best, I don't think that we have it in us to give the effort to be, you know, totally clean all the time. We all make mistakes, and, you know, you don't mean to do something, but I think that's inevitable. And so the more that you expose yourself, the more you're putting yourself and those around you exponentially at risk. So definitely thank you for making that point.
Yeah.
All right, love. Well, I'll let you get back to your packing and your meditating and journaling, and I'll be sending you some protective light bubbles for your trip and your experience.
Thank you.
Thank you again so much for your time, and maybe I'll connect with you again while you're after the 13 weeks. I'll connect with you again, and we'll see how you held up.
Okay.
All right, cool. Thank you so much. I'll talk to you
Thank
soon.
you. All right, bye.
Bye.